Welcome, Professor Thomas. Thank you for joining us this morning. In the general community, we've seen smoking rates drop from about 33% in the early 80s down to less than 13% in 2014. What's happening in the Aboriginal community?
Aboriginal smoking is falling just as smoking is falling in the national population, but from a much higher level. So Aboriginal smoking is now down to 42% from a high of around 50%, but it's still 2.5 times the smoking prevalence in the rest of the population.
Just how important is it to engage Aboriginal communities in planning their own strategies and programs to reduce smoking?
Absolutely essential to involve Aboriginal and Torres Strait Islander communities, Aboriginal and Torres Strait Islander organisations, Aboriginal and Torres Strait Islander people all need to be involved. But it is also important to note that some of the mainstream activities are also effective, so that whilst those Aboriginal and Torres Strait Islander specific activities are an absolutely important complement, mainstream sort of smoke-free regulation, tax, and advertising campaigns also work with Aboriginal people as they do work with other Australians.
We've seen some social marketing campaigns feature Aboriginal people, engage with Aboriginal people in the planning of how smoking is depicted in Aboriginal communities. Is it important to have separate campaigns for the Aboriginal community compared to the non-Aboriginal community?
Look, we've found that whilst the mainstream campaigns, work, there does seem to be an additional complementary effect of the Aboriginal specific campaigns and of course the local campaigns as well. So I don't think it's an entirely an either or, and the balance needs to be carefully made so that all the resources aren't lost from the mainstream campaigns, so that we don't want too much fragmentation, but we do know that those more targeted campaigns have an additional benefit.
Smoking is a huge contributor to the life expectancy gap in Australia for Aboriginal people. How big is it, and how do we get that message across to both the non-Aboriginal communities and politicians?
Certainly Aboriginal and Torres Strait Islander people, their organisations, I think politicians are now getting it that 1 in 5 Aboriginal deaths is estimated to be due to smoking, 1/6 of the health gap is due to smoking. I think they get it. I think the funding is now, has in recent years has started to flow. It was reduced somewhat in the 2014 budget, but there's still significant funding and policy attention, as there is attention in the community. But I think it's just as important as saying the problem is huge. It is also important to say the solution is achievable. And so I think some of our recent work has suggested that reducing Aboriginal smoking is quite achievable. A lot of the traditional measures of tobacco control will work and are working for Aboriginal and Torres Strait Islander people, and Aboriginal and Torres Strait Islander people are giving up. And I think we should be celebrating that, not only talking about the size of the problem.
And can you give us a couple of quick examples of the most innovative strategies you've seen at the community level?
Look, of course there are many innovative projects, whether they're using new technologies like social media or using traditional things like talking to people, yarning up about smoking. I mean, there are as many different innovative things as you can possibly imagine. It is important to also sort of remember that a lot of the established tobacco control activities work. NRT, varenicline, they work for Aboriginal and Torres Strait Islander smokers. We should be encouraging as clinicians, encouraging them to use those medicines. We know that brief advice by health professionals work and is in fact being done better for Aboriginal and Torres Strait Islander people than other Australian smokers.